Did you know that low vitamin D levels can significantly increase your risk for gestational diabetes during pregnancy? Most women aren't told this, but research shows that vitamin D plays a critical role in regulating blood sugar levels during pregnancy. In this video, I'll break down exactly how gestational diabetes develops, why vitamin D is important in insulin function, and how you can optimize your levels to support a healthy pregnancy. Hi, I'm Stephanie, aka The Healthy Practitioner, board-certified family nurse practitioner specializing in integrative medicine. I've helped hundreds of women on their hormone journeys, helping them optimize their pregnancies and helping reduce risks like gestational diabetes. So let's dive in. So what is gestational diabetes? Well, gestational diabetes, GDM, is a temporary form of diabetes that occurs during pregnancy when the body can't regulate blood sugar properly. Normally, insulin helps glucose go from the blood into cells. During pregnancy, with hormonal changes, the body keeps more blood sugar in the bloodstream so that it can make sure that the fetus is getting enough glucose. Sometimes that goes in overdrive and there's too much sugar in the bloodstream, and then that equates to hyperglycemia or increased blood sugar. Who's at risk? People with GDM typically can be overweight or have polycystic ovarian syndrome. Both of those increase the risk for insulin sensitivity. If you have a family history of diabetes, if you've been pregnant before and have had diabetes in the past, you also have an increased risk. And then if you have low vitamin D levels, which we'll talk about today. So, symptoms of gestational diabetes is increased thirst or frequent urination, fatigue beyond the normal typical pregnancy fatigue, and blurred vision or sugar changes, and sugar cravings especially. It's typically diagnosed between weeks 24 to 28 with a glucose tolerance test, GTT. I have a whole other episode on glucose tolerance tests in the future. I have preferences that are different than the standard American testing. I like doing blood sugar tests throughout the day for a week or two, but we will talk about that some other time. So how does vitamin D affect blood sugar in gestational diabetes? Well, there's a scientific link. So vitamin D helps insulin work properly. Insulin needs insulin receptors to work. Vitamin D increases these receptor cells' activities. When vitamin D is low, fewer insulin receptors are available, making the body more insulin resistant. Second, vitamin D supports pancreatic beta cells. The pancreas is what produces insulin. Vitamin D helps regulate calcium levels inside these pancreatic beta cells, keeping them functioning properly. Low vitamin D equals low beta cell function, which means that they can't properly make insulin, which equals higher blood sugar in the body. Vitamin D also reduces inflammation. High inflammation equals high insulin resistance. So chronic inflammation disrupts insulin signaling. This is why vitamin D is so important for everybody, not just pregnant women, because it helps with inflammation. Low vitamin D has increased inflammatory marker risks, more inflammation, more insulin resistance. Lastly, vitamin D affects the GLUT4 receptor. GLUT4 helps glucose enter muscle and fat cells after insulin binds to the receptor. Vitamin D increases this activity, allowing more glucose to be absorbed. Low vitamin D equals less GLUT4 activity, higher blood sugar levels. There's a study in diabetes care that shows women with low vitamin D had 60% higher chance for developing insulin resistance. Research suggests maintaining a level between 50 to 70 NGs per milliliter can reduce this gestational diabetes risk. So getting your levels tested at the beginning of pregnancy is always a really good way to just check and see where your baseline is. We typically use different types of form of supplementation, food suggestions to help raise that up, and sun exposure. So let's talk about how we can optimize vitamin D levels. First off, like I mentioned, sunlight exposure. Getting 20 to 30 minutes of direct sun exposure on the skin without sunscreen helps the body produce vitamin D. So depending on skin tone, where you're located in the world, what season you're in, currently we're in a winter season, we're not getting as much of the high quality rays that are absorbed in the body as vitamin D. So using alternative supplementation is usually really helpful. My girlfriend gave me an app, it's called My Circadian, and it will show when the UV light is best for absorption of vitamin D outside. Supplementation. Most pregnant women don't get enough vitamin D from food alone, so a standard prenatal typically has 400 to 600 IUs, but research shows that they need around 4,000 daily for optimal blood sugar control. So with Select Balance, our own supplement line, we have the Prenatal Complete, and in 2 capsules, there is 2,000 IUs of vitamin D. So women can do 2 caps in the morning, 2 caps in the evening, or they can just do 2 caps of this daily and then supplement with the vitamin D. There's drops or capsules. We also do injections for people that are appropriate for that. The best is to talk to your provider and see what is best for you. Vitamin D foods. Fatty fish like salmon, sardines, egg yolk, fortified dairy products, and mushrooms, if they see sunlight, are higher vitamin D rich foods. Fortified dairy, 1, dairy gives us a lot of inflammation, which can make some insulin receptor issues. And 2, fortified is usually the cheapest version of that vitamin put in these foods. So when you see fortified cereals or milks or orange juices, whatever, I'd run from that because, again, typically if you're looking at the back, it's fortified with B12. It will be a cyanocobalamin, a junky unmethylated type of B. So we really want to make sure we're getting high quality nutrients, whichever way we're getting them. So gestational diabetes is preventable, and optimizing your vitamin D level is one of the easiest ways to support a healthy pregnancy. If you found this video helpful, give it a thumbs up, subscribe for more pregnancy and hormone health tips, and check out the description box for my free pregnancy wellness guide. Until next time, thank you.